Welcome, my YouTube friends. We got a Jubilee video today. Pro versus anti-lockdown. Should we reopen the economy? Jubilee, take it away.
Hey, good humans. Before we get into this episode of Middle Ground, here's a quick teaser of The Leap that's coming soon.
Don't care.
So stay on the lookout for that video of The Leap that's coming out soon. And if you want to challenge yourself and reach out to
By all means, roast away, Lester Axe.
someone to reconnect and take the leap, then click on the link in the description below. And now, enjoy this episode of Middle Ground.
There are people making the argument that we should end self-isolation because a few 100,000 deaths is worth sacrificing for the economy. Some people would agree with that until it's their mother who dies, or their uncle, or their grandfather.
Nearly a dozen other states will start to ease their restrictions as they slowly start the reopening process.
It may not come back at all. There will be coronavirus in the fall.
I can see the emotional agony it causes in patients and their family members.
Restrictions should have been put on the people that are sick.
I don't think it's a good thing for our economy or our country.
So I had to lay off my employees. We have no work.
I believe that it violates our most basic of civil rights.
I wouldn't say that I'm necessarily anti-self-isolation, but more so anti-government imposed self-isolation.
Our new normal does not mean that we will sacrifice our freedoms for our safety.
The key thing is that working with good data is going to allow the U.S. government to continue to make better decisions.
I'm not able to work in my given
Okay, before we go on, I want to see what the people they have on here, because they often sort of stack the deck in these middle ground. Let's see. So we've got YouTuber, Graham. Okay. So, my Catholic perspective, 7,000 subscribers, not interested. Okay, pornography can influence homosexual attraction. Okay, so, gotcha. Now a 358 follower Instagram poster. Looks like it's pretty cool. Seems fairly normal. For certain values of normal. I mean, he doesn't seem like a conspiracy theorist or anything. Seems like just a regular dude. Selfie Queen of Charlottesville, female. Okay, cool. Dr. Q. Talked to many police officers at the San Diego protests today. They are on our side. Okay. So, yep. 43,000 followers. Doctor. Okay, will be Rona is real. Dr. J. Rutland. That's this dude. Yeah. So, okay. I'll bet this guy's based in on our side, so that's good. There's another doctor with 52,000 followers. You know, I know they say it's bad to judge a book by its cover and all that kind of shit, and oh, Jubilee is a website that they host a variety of videos, but their most famous thing are these Middle Ground, where they take 3 people on one side and 3 people on another side and just ask them questions and have them discuss, argue, etc.
Hey guys, we hope you're safe.
I'll be totally honest, they're usually fairly good discussions, but they often tend to stack one side. Like on, I've done a few of their videos and seen other content creators do them. But let's see. There's one they did a while ago where it was like 3 professional YouTubers against 3 regular people. Yeah, they did one about trans versus cis, and first of all they called it trans versus standard or normal or something like that, and they had like Blair White and another, yeah, sometimes it was comically stacked. The one I'm thinking about, they had Blair White and another an Australian YouTuber who is pretty fashy. So yeah, it's... Anyway, yeah, that's what Jubilee is. They're usually some good information, but they can often be pretty stacked. So, as I was saying, I don't want to judge a book by its cover, but this is radiating the most Karen energy I've seen. I could be wrong here, and I may be... But, oh, I see. Cornea, cataract, and LASIK surgeon. Yeah, that's not who I'm going to about viruses. Sorry. And Wake Up Call America. Pro-God, pro-life, pro-2A, pro-Trump, pro-free market. Okay. This actually may be one of the most balanced videos they've done in a while. Because it seems like they have two fairly popular doctors on here. I mean, Instagram popular. And some people who are relatively unknowns on both sides. So it may be fairly stacked. Maybe because they couldn't get them all in one place.
Despite this, I'm pro-quarantine.
I own my own practice, but because of the quarantine, I'm only seeing patients 2 times a week.
Okay, I take it back. If she's pro-self-isolation, then cool. I take it back about her being a Karen, but let's see the rest.
It might be hard to understand why people would gather like this while a deadly virus ravages America.
What if it was your mother? What if your infant son or daughter gets sick?
Bare Bones Talk? No, I'm not familiar with them. Are they here on Twitch or on YouTube, or where are they? I've never heard of them.
My name is Cedric Jamie Rutland. I'm a pulmonary critical care physician in Southern California, Newport Beach, and Riverside, California, and I am pro self-isolation.
Hi, I'm Dagny. I'm an ophthalmologist. I live here with my husband. I'm an expecting mom-to-be here in Orange County, California, and I am pro self-isolation.
Hi, I'm Alex. I live with my boyfriend and another roommate in a very small apartment, and I am pro self-isolation.
My name's Austin. I'm a chiropractor. I live here in Newport Beach, California. I would consider myself anti-self-isolation.
Hi, I'm Allie Marie. I am a massage and craniosacral therapist by trade, but am currently a stay-at-home mom, and I'm about 20 weeks pregnant, and I am anti-self-isolation.
Hi, I am Julia. I live with my family here in Texas. I am anti-self-isolation.
I know somebody who has been infected with COVID-19. Can the disagreeers please turn off their cameras?
Yeah, imagine that. The doctors know people who have been infected. Like I said, I think this is actually a comically stacked on the correct side for once. 2 actual doctors.
I know a physician colleague in New York who was infected and actually is an expecting mom, but thankfully she's doing okay and on the road to recovery. I also know someone from my neighborhood who unfortunately passed away, and he's actually relatively young.
One old partner of mine who's a little younger than me, probably 34, 35, who was infected with COVID-19. His case was mild. I had another physician friend of mine who was older, probably about 55 or so. He was infected with COVID, and I had to take care of him.
I'll talk to a little bit different point maybe. One of my coworkers here, her father had a heart attack, but he was diagnosed with COVID at the hospital, and ultimately they were told that COVID-19 killed the patient, when really it seems that the heart attack and complications from cardiovascular disease were ultimately the issue. The other healthcare professionals in the group here, I would love to hear your opinion on that as far as what you maybe heard about how they're counting who qualifies as a COVID case and what the cause of death was necessarily.
Here's what we've discovered. When you look at these patients that have COVID-19, is as a result of the presence of the virus within your blood vessels and your bloodstream, it leads to the activation of the coagulation system. So their blood can clot easier. So we've seen heart attacks, we've seen strokes, we've seen pulmonary embolisms. And so your point is well taken. He died of a heart attack, yes, but COVID-19 is a significant risk factor of coagulation.
So this goes to what they were talking about in that Plandemic movie about how people are being listed as deaths due to COVID just because they were infected with it. The COVID very well could have been a significant contributing factor. Exactly.
The disagreeers can join the conversation now.
I do want to talk about the antibody test that they've started and the extreme percentages that they've seen. There was the one that they did randomized in California recently where they were getting as high as 55%. For all I know, I've had it. My daughter and I were sick for 4 weeks, 6 weeks this winter. Right now in Michigan, Governor Whitmer is calling for all essential workers to be tested, but there's no antibody test to go right alongside it. So my husband, who's an essential worker, could go get tested, comes back negative. What, does he have to get a weekly test now when he could have already had it this winter with us and just had very mild symptoms?
I'd like to make a point because I want the doctors in the group chat to respond to this. I have heard that getting COVID does not mean you won't get it again.
There have definitely been cases in the US and outside showing that those who recovered actually went on and tested positive again for the virus. So that is a little bit concerning because we were all kind of betting that once you get infected, you'd be immune. That previous assumption.
I am curious if the situation is once you've recovered, you just basically revert back to asymptomatic carrier. Because I know that is like, we have a bunch of diseases, like as humans or whatever, we have a bunch of diseases that as we've just developed the antibodies and are immune to them. We don't have any effects of them, but they're still in us. And it's, I mean, this is what happened in, when the Europeans came over to America. They brought a bunch of diseases that they were all, they all had herd immunity to. It wasn't an issue for the vast majority of Europeans, but the peoples in the Americas hadn't encountered them and they got sick with them. So I'm wondering if that's what the situation here is. Not that you can, like, once you've recovered, you are safe. You're not going to catch it and get sick and have symptoms of it, but you're still a carrier. So that is a real issue that we would need to deal with.
Was based on what we know from similar viruses from before. It just goes to show that we still don't know a lot about this virus.
The scare of the virus is overhyped.
I think that the scare has been largely driven by the media. I know that initially there were models that came out of the Imperial College of London that claimed that millions of people would die. That was really used as the justification for these massive lockdowns, and we have not seen those numbers pan out at all.
Because of the lockdown. We didn't see those numbers because of the lockdown. They said that those numbers would happen if we just went around business as usual.
I totally agree with you that a lot of what we're seeing is media-created hysteria. There's a lot of new information that's coming out. We really think people were trying to do their best with the data that they were provided at the time. I especially have an issue with how the data is actually being collected and then ultimately how the deaths are being counted.
Since we initiated social distancing, especially when you look at California, you can see that the amount of infections has slowed. And I actually saw this in the hospital. I saw the uptake, and then all of a sudden, as the governor got more restricted and as the state got more restricted in terms of isolation, you could see that California was beginning to flatten the curve and actually lead the nation in that. I agree with the self-isolation principle because it did what it was supposed to do, which was prevent the amount of infections to bombard the hospital, because that's not what you want. I mean, we still have physicians getting infected, and the more infections you have in the hospital, the more likely it is for one of us to get infected, and then you have a reduction of healthcare workers to be able to manage these patients.
Someone called it even well ahead of time. If we find that weeks or months from now, the cases are not as bad as projected, people will say that we overreacted. When the truth is, that's just evidence that the things that we're doing right now, including self-isolation, has worked. And
true! Yeah, this was all predicted months ago, that if social isolation works, then everybody's going to say it was an overreaction and we didn't have anything to worry about.
For those people who continue to compare, COVID-19 to a really bad flu season, well, let's look at the data. They're saying that, okay, a bad flu season, we have 60,000 deaths in the US. Right now with COVID-19, we have about 50,000. So it's comparable.
Yeah, and as of April 30th, it was 63,000 deaths. And I think we're actually over 70,000 now. Yeah, 73,000. Less than a week later. Yeah. So, there's that.
Well, we have to look at the rate at which that's happening. That's in 1 year. Right now, we're in April, and we're already matching the worst flu season. I do agree the media is always biased, but when we have epidemiological and infectious disease experts calling this a pandemic, calling this as something unprecedented.
Completely unrelated to what she says, but I have long hair. I hate having my hair in front of my eyes. How do these people do this shit? Is this a woman thing? Is there a woman in the audience who can explain this? Because I could not stand to have my hair over my eye like that. It would just drive me bonkers.
I think that's real, and that is not hype.
In terms of the hospitals being filled to capacity, that's obviously a situation that nobody would want. It appears to me that the US healthcare system didn't become as swamped as they had originally predicted. And I think that going back in history, quarantines tend to be for the sick as opposed to the healthy. And I wonder if maybe we would take more of an approach where the sick are being quarantined, which I think is very justifiable, as opposed to everybody who's healthy being quarantined. That might be more appropriate.
The issue with that is that we don't know who's sick with SARS-CoV-2. There are many different estimations of how many people are asymptomatic. I myself have seen people be asymptomatic that are positive for the virus. So that becomes an issue. At least with the Spanish flu, you knew who was sick. And so until testing is rampant throughout the country and we're able to know who is asymptomatic.
Yeah, the 1918 Spanish flu pandemic infected 500 million people. The death toll is estimated to have been anywhere from 17 to 50 million and possibly as high as 100 million. And remember that there was... Oops, shit. Remember that there was a... Is this?
There are many different estimations of how many people.
There was a period where they thought everything was fine, so they went back to normal, and then like another 20 or 30 million people died as a result. So please learn from the 1918 flu pandemic.
Testing is rampant throughout the country, and we're able to know who is asymptomatic. I agree with you. Quarantining the people who have SARS-CoV-2, if we tested everyone, is the most appropriate and probably the single best treatment that we can provide across the nation.
With the United States, our judicial system is founded and rooted within innocent until proven guilty. Now, I'm not...
Judicial systems have nothing to do with medicine. Sorry, lady. This isn't a punishment. This is public safety, public health. My grandpa used to tell stories about the flu. He was born 10 years later, but our little farm town was still reeling from it when he was a kid. Yeah! What was the population of the U.S. in 1917? So in 1917, look at that. 60 million people died between 1917 and 1918. So there's 103 million people in the U.S. Or no, that's 60,000, excuse me. So 103 million. I imagine a small farm town, even if it's not as hard hit by the flu as other more densely populated areas would be, you're talking about losing a lot of, not only a lot of experience and intelligence, but also losing a lot of able-bodied workers, because the flu didn't just kill the old and infirm.
Saying there's anything wrong with us acting like we're a carrier, washing our hands, using antibacterial sanitizer, but ultimately...
Yeah, Magno, but what do you expect from this kind of thing? I mean, these are the kind of people who claim that the Me Too movement is not following due process when someone is socially ostracized for sexually assaulting someone.
I don't think it's right or fair for the government to say, you're not showing symptoms, but you could be sick, so you're going to stay home. It's like sending somebody on trial to prison because they could have been guilty.
This isn't like putting people in prison because they're sick. I think this is actually more of a political difference than, like, I guess, a medical argument. There are people making the argument that we should end self-isolation because a few 100,000 deaths is worth sacrificing for the economy. I disagree with that. Some people would agree with that until it's their mother who dies, or their uncle, or their grandfather.
Slowing the curve is more important than human rights during the quarantine.
All threes are going to go dark. Oh, wow.
All right, I guess I'll be the devil's advocate and just I'm going to take issue with the framing. Probably a better phrase would be civil rights, perhaps. Limiting people's ability to gather is certainly an infringement on civil rights, but I would agree that the actions that have been taken are worth slowing the curve. Everyone can attack me now.
There's no attacking, man. It's a hard one.
There's no attacking. I just wasn't going to make a ridiculous, like, extreme statement. That's crazy.
So I'm in Michigan, where some of the most extreme lockdowns have taken place. Governor Whitmer just today extended our stay-at-home order 15 days, but relax.
More extreme than New York City? I mean, I'm assuming, just for my own sanity, that she's referring to lockdowns in the U.S., because, you know, in China, they were welding people into their homes, allegedly. I don't know that Michigan has had worse lockdowns than, like, New York or the Seattle area or LA County.
Next, some of the restrictions that everyone was so mad about. As far as, you know, there was a huge Lansing protest recently, Operation Gridlock, that was organized by the Michigan Conservative Coalition. That was all about the fact that she was not allowing all of these businesses to work that were able to practice social distancing. Some governors are willing to go to whatever extent it takes, because it definitely has been an infringement on, like, all of our civil rights to be able to go out. I mean, Harris County, I believe it's in Texas, right, that just said that you'll be fined $1,000 if you don't wear a mask in public.
The local police union in Harris County actually came out and said they will not be enforcing that because they view it as unconstitutional. There's definitely a balance there between federal overreach versus states' rights. So California, even where you are.
But wasn't that the state's decision to implement that law? Or the county decision? I mean, it's a federal recommendation, but I don't think it's been a law or anything like that. So if the state chooses to enforce it that way, can you really be an opponent of states' rights then?
It's a very different scenario in terms of the level of outbreak, the number of patients. Taking kind of an individual approach, I think, is important. If you're
Magno, you're talking about the brunette or this blonde? Because, yeah, that brunette is radiating some strong freak energy, too.
in a state that has seen very few cases, I don't know that the response needs to be the same. The federal government stepping in would make it a one-size-fits-all, and I don't know that any of us would feel that was appropriate.
I think that...
Yeah, this one here, she definitely is radiating some strong freak energy with all her crazy talk.
That charging people $1,000 fine for not having face mask is classist and is regressive. Who's less likely to...
Oh, do we have a comrade here? Fuck yeah! Yeah, that is definitely classist. Because what that means is that wealthy people are like, it costs $1,000 to not wear a mask. Whereas other people are like, I have to wear a mask because I don't have $1,000 to pay the fine.
Have access to masks, it's poor people, and they don't have $1,000 to pay a fine. I agree that, you know, you have to find a fine line between an authoritarian response and something that's responsible to all people. I think that the federal government, and I'm talking about both parties here, I have a lot of issues with both sides. I think they need to be taking a leading role. When you have disparate responses from states, what you risk is states with a less extreme reaction or protocol. You risk those people going across state borders and actually spreading the virus more. And we don't want to get to a point where we have to shut down state borders.
The US government is handling the crisis well.
Okay, my prediction is these three will probably... I think these two will probably stay live. I don't know about these three. But yeah, I think most of these people are probably gonna go dark here. Called it.
I am very torn on how I actually feel about this. My dad owns a small business. I've read a lot of the different arguments on the payroll protection plan and a bunch of the different deals with Shake Shack and everything else, which there are a lot of details that go into that. If 75% of any loan that's given to the business owners has to be paid into employee benefits. He has a company that has 220 employees, so you're talking $65 million in revenue every year. And so some would say his business is too big. He shouldn't have gotten it. But that's 220 employees that he's taking care of. There can be an emotional response saying they're not protecting the mom and pop shops. They're not protecting this. But ultimately, 220 employees are getting their salaries and 4 aren't. And while it's emotionally sad to see those smaller businesses forced to close, we're going to be in a little bit of a depression. We're going to hit a recession. And so we're all in this together. And I think the bipartisan support has been really lacking, especially in the beginning. But I think that they're somehow finding a way.
I am very curious about how she finished that sentence. Because they clearly cut her off before she could say something stupid or really bad.
So all I'm saying, and I think it's really simple, is you have all this money that we're giving to businesses, and I think it's appropriate, and I think that they should. The issue is just testing. Take some of that money and give the country some tests. Antibody testing and the PCR testing. So until that's done and distributed across the country, no, I don't think it's a job well done.
Can you tell me why that's such a priority? I know we need to know how many people have it, but can you explain to me why that's so critical? I just don't know.
If we give everyone an antibody test, we're going to know who the sick are. IgM is what gets produced acutely. It's a type of antibody in your bloodstream to SARS-CoV-2. So you'll know who's infected. IgG means that you've had a sustained response to the system and your body has had enough time to develop a neutralizing antibody. So you'll be able to quarantine the sick without being symptomatic.
I haven't got my stimulus.
Yeah, the "we're all in this together" meme is really chapping me, especially when I see it coming from wealthy people who aren't actually worried about how they're going to survive through this quarantine. Like, we are definitely not all in this together. Though we definitely should be.
Let's check. Yeah, I don't know about anybody else. My rent has already been due. Where the hell is the check? I already need another check. The government needs to be focusing on helping individuals who are stuck at home and who have no way of surviving. I think the fact that the federal government, the White House specifically, for months was saying that this was a hoax and that this was completely blown out of proportion was hugely detrimental to our response.
South Korea did a great job. Taiwan did a great job, but unfortunately...
I mean, 2 of these people are actual medical doctors. They're not all college kids. This is actually a doctor.
That is not what I can say for the United States. Things are turning around, and all these stimulus packages that they're doing, the fact that they're vowing to expand testing is definitely on a better track. And my husband, he was one of the first in line when that CARES package came out to sign up for the forgivable business loan and the PPP. And he didn't get it. And it was heartbreaking to hear that these large corporations were getting access to that money. So even though the government was doing something of good intent, the way that it was executed, unfortunately, wasn't the best.
Daggy, you mentioned the South.
I mean, 4 of the people on here are regular people.
Korea and admired South Korea, how their response was. Well, to my knowledge, they had trackers on everybody's cellular device that was monitoring where they were going. That just in itself, to me, is a completely asinine principle from the First Amendment. Like the fact.
So, I actually remember something about this, and the issue was not that they had trackers in everyone's cell phones, because, newsflash, every phone made in the last 5 or 6 years has a GPS in it, and so at least the service provider knows where that phone is. The issue in South Korea was that they were sending out alerts that someone who tested positive for COVID visited these locations, and people were able to essentially cross-reference those with other public information and identify people. So if you have an issue with your phone having a tracker, you gotta throw away your phone. Or, I mean, just turn off location services and accept that you can't use it as a GPS or get location-based effects, but, you know, one or the other.
The fact the government is tracking your every move seems.
Describing our government reaction as not the best should be punishable by 10 years in prison for reckless understatement. Yeah. That's because of capitalism, which is why large corporations are getting it, and also large corporations contain 6-figure number of employees or more, so that might be helping more than it is helping less. I think I've read that the majority of American workers live in or work for companies of 500 people or fewer. So it's not that which is what is classified as a small business. Yeah, the issue is that it's not being distributed properly to the workers themselves. And yeah, Magmill, I got in a well, it wasn't really a fight. We were just we'd wrapped up our Pathfinder session, and we were talking about the lockdown and stuff, and I commented how poorly Trump has handled this situation, and one of the guys I play with was like, "Oh, Trump handled it just fine. We didn't do anything different than Italy or Germany." And I'm like, I'm not getting into this right now. I just didn't have the energy.
It's a lot like house arrest.
The tracker system that South Korea used has generally been praised by most countries, and one of the main reasons that they were able to avoid a peak.
Actually, Magno, it was the same guy who commented on my Facebook a month or so ago about how we wouldn't hit 10,000 deaths or whatever, if you remember that. You commented to him. He has since changed his tune and accepted that we're going to see a lot more deaths, but he still apparently thinks that Trump handled things properly. Either that or he thinks Italy and Germany handled it worse, even though they're doing better than we are now.
And have to implement quarantine, and we, the US, are actually taking lessons from them, but it's not as authoritarian as you think. We all have the option to opt out, but the only way this is going to work is if you opt in, and that's for people who decide that the public good is of higher benefit right now than our own individual, I guess, concerns for privacy.
So, Dagny, you're talking about different countries and what they're seeing. Sweden never did a lockdown. They said if you're vulnerable and at risk, stay home. Don't go to work. And their chief epidemiologist right now is saying that they are very close to reaching herd immunity. So within this whole idea of staying home to avoid...
Really? I mean, yes, they have fewer deaths and they have fewer confirmed cases than we have deaths. But yeah. Reaching herd immunity? Okay, coronavirus and the herd immunity myth. But the United States shouldn't copy it. Countries battling the coronavirus pandemic, Sweden sets a seductive example. While the world's biggest economies have shut down, one small, well-governed Scandinavian country has allowed most businesses to stay open. The strategy apparently relies on herd immunity, in which a critical mass of infection occurs in lower-risk populations that ultimately thwarts transmission. But the reality is not so simple for Sweden. Government authorities there seem to be for this strategy, then against it, then for it again if the data looks promising, and it's dangerous to assume that even if the strategy works in Sweden, it will work elsewhere. Leaders are grasping for strategies in a time of great uncertainty, but the Swedish model should be approached with caution. In Sweden, business is not actually proceeding as usual. Most travel and mass gatherings are not allowed, and some schools have been closed, but restrictions from government are considerably less severe than many other countries. Restaurants and bars are still functioning, some of them only with minimal distancing taking place. The results have been mixed. Sweden has the highest fatalities and case count per capita in Scandinavia, but is lower than some of its neighbors to the south. Economic disruption has been significant, but not as debilitating as other countries. In the capital, Stockholm, the nation's top infectious disease official recently estimated that approximately 25% of the population has developed antibodies. It's too early to tell whether the approach has worked. Stockholm isn't all of Sweden, and 25% of its population with antibodies is not cause for an immunity celebration. We don't know if that percentage is accurate because the data isn't available, the antibody tests still appear to be of uncertain accuracy, and we don't even know what a positive antibody test means. There is some optimism that most people who are infected will have some temporary immunity, but if immunity is short-lived and only present in some individuals, that already uncertain 25% becomes even less compelling. We also still don't know what total population percentage would be necessary to reach the herd immunity goal. It could be as high as 80% of the population. Even if we had perfect knowledge of the Swedish case, there are huge risks with copying the strategy in a country like the US. The American people are far less healthy than Swedes. Yeah. They have significantly higher rates of diabetes and hypertension, two of the most risky underlying conditions. 4 out of every 10 Americans are obese. A herd immunity strategy in America would mean that many of these people would be on some form of lockdown for many more weeks, most likely months. Moreover, the Sweden example demonstrates that a targeted herd immunity strategy doesn't do much to protect at-risk populations either. Okay. Yeah, so she's full of shit, as expected. Sweden is also in the bumfuck outskirts of Europe and in the middle of Norway and Finland. They're not locking down, but people are social distancing and decreasing work hours. You need a freaking ferry to even get into Norway and Finland, not like the US. You can just drive back and forth. Yeah. Yeah, I hadn't actually seen much about the Sweden argument, but I do see how people who don't understand the whole of this story can make that argument. That's some bullshit.
Avoid a second wave. A second wave is inevitable. Right now, the federal government recommendation...
No, it is not, you stupid fucking Karen. A second wave is only inevitable if we assume it's actually all taken care of and don't test people.
On when you can reopen your economy is if you see a daily decline in positive cases over 2 weeks. And regardless of when those 2 weeks are, it's gonna start to rise again when everyone starts being around each other. There's no negating it. We can't stay locked up in our houses for 3, 4, 5, 6 months. There's some doctors saying that we're gonna still be seeing COVID cases for 18 months.
When we compare the US to...
No, she is not a doctor. She's a... let's see. Which one was she? Was that Julia or Ali Marie? Yeah, she is the Reflections of a Laywoman with interspersed live streams and extras. So let's check her About page. Just a Catholic girl in the world learning how to reach her potential. All glory be to God. Yeah. Hardcore Karen. Hell's Waiting List. Oh. Oh, that would be... Yeah. Yep, Tradcath. She's the doctor of my heart, though. You may want to get that looked at, my dude.
Other countries, I think we were more similar to the tracks of Italy and China. I don't think herd immunity works for every country. It's really going to be specific to, the region itself.
I'm comparing Michigan to Sweden because they both have approximately...
You can't compare individual states to whole European nations, even if they have similar sizes and populations, because it's much harder. There is some comparison, but the way we interact state to state is a little bit different than the way nations interact. And especially, as Lesterac said, if you have to take a ferry to Sweden or to Norway and Finland from Sweden, that's a little bit different than like where I live, where there's a highway that's barely a highway to get to the state next door. Like, and the only reason there's really a highway is because there's a fucking river.
Approximately 10 million people in their population. Population density is about the same. And Sweden has a far less death rate and infection rate than Michigan does.
Heterogeneous compared to Sweden.
Dagny, I feel like we have like the same mind or something. Because I brought up this article about Sweden, and the situation there is very different. They have far more single-person households than the United States does. They have a much more robust social safety net, so people who want to opt out of exposing themselves don't have to worry.
There are no direct trains between Sweden or Norway and Finland, but the bus over the gap from Boden-Luleå to Kemi, Sweden to Finland, is free with the Eurail Pass. Finland can also be reached by ferry from Denmark, Germany, or Sweden. You can get a 50% discount on most ferries with your pass. So yeah, it's not just hop on the highway, hop in your car and drive. You have to specifically get a ferry or something like that. It's much more difficult to leave or enter Sweden from its neighboring countries. So yeah, you can't compare Michigan to that.
Worry about not paying their bills. And the Swedish government is actually reconsidering their herd immunity approach and considering taking stricter measures because they're seeing the cases in Stockholm rise. There are people in the Swedish government who are saying they might regret the herd immunity approach. And it is a much more homogenous society.
This guy looks familiar, like I've seen him somewhere else before. I don't think it's been another Jubilee video, but he looks familiar.
You know, I hate to say it, but there are societies that take more responsibility to the health of like everyone around them. America is a very individualist country.
The lockdown is harming my mental health.
No one should darken their screen here. It's affecting everyone's mental health. Wow. Okay, cool.
I have patients that are still coming in, so we get asked about this every day. Like, Dr. Kwon, like, what do you think about the lockdown? What do you think's going on? I've not only been doing and working my normal scheduled hours here at the office, but then we go home and I'll spend hours and hours.
I mean, Michigan has a high Scandinavian population, so they're exactly the same.
Hours and hours until the wee hours of the morning researching, trying to stay up on the new stuff that's coming out on the coronavirus. So it has been very fatiguing and toiling on me, just being able to take care of patients and do my normal daily routine. Obviously, no deaths are discounted or lost, or we care about everybody who's dying in all of this. But you got to look at like child molestation rates that are going up. You're looking at spousal abuse rates going up, suicidal issues, depression, anxiety, overall lifestyle choices people are making, and especially mental health concerns through this isolation is definitely another factor that we're looking at. We might be stealing from Peter to pay Paul, this kind of idea when it comes to where we're looking at the deaths actually occurring.
Has my mental health been negatively affected? I feel like that would maybe be stating it a little bit too strongly. Some of you have mentioned we appear to be going the route of a depression. That's a scary thing. It's really sad. It's going to have a profound impact on people's lives. And this might be too personal, but I feel like ultimately God's in control and I have to just, that's something that I have to accept. And it gives me
God botherers out!
a little bit of peace too.
I feel like not having a lockdown would probably affect me more because it's the infection that scares me more. If I had to continue my normal patient caseload and surgery caseload at my practice and be paranoid about every patient thinking, are they infected? Are they going to infect me? And the fact that our supplies, our PPE is running down as well in my own private practice, that would be more mentally straining to me personally.
It's not that the presence of all of these restrictions is not harming my mental health. It's just that I feel that the restrictions are appropriate. My job as a pulmonary and critical care physician has changed forever. I have to now worry about COVID-19 in almost every patient that I see because I'm a pulmonologist and they present with respiratory failure. And I have to be super protective and super cautious when I'm dealing with an outpatient, when I'm dealing with an inpatient on call in the ICU, as I was last night, from here on out until a vaccine comes or whatever. And this is something that I have to deal with because I have two small little kids. I have a 5-year-old and a 7-year-old little girl, and I got my wife.
The one issue I have with this format that they have to do due to the lockdown and social distancing is that, because obviously you can't fly 6 people who have never met to a studio and have them sit on stools and talk about this kind of thing. I understand why they did this, but because of the way it's set up, you can't have anyone, like, a lot of times in these Jubilee, you can catch people making faces or reacting in the background to something someone says. And with this, since they mostly just fill the screen with the person who's talking, you don't get that unless they specifically cut to someone else to catch a reaction. They don't always show those reactions in the, in the ones where they're all in the same place, but you catch them in the background or what have you. And it just adds some interesting reactions in the sort.
Wife, and I just feel that I have to protect them.
I have felt judged by the other side.
If you oppose continued quarantine, mass quarantine, I should say, people judge you and make the assumption that you don't care about somebody's life. That's categorically not true. I care very much for people that are suffering and people that are dying. And I don't want for that to happen to anybody.
My sister-in-law specifically, she was not happy because I had said that Whitmer was thinking about extending the order 70 days and how I wasn't sure how I felt about it. And I mean, we're not even actually on speaking terms right now because she was so angry at me that I...
Hold up, Magno. You haven't heard Coomer yet? I thought you watched Bosch. He always talks about Coomers. Come on, man. Keep up.
I would even potentially think that we shouldn't all be quarantined by the government right now.
As a doctor, I truly believe I took an oath to protect my community and to always have my patients' best interest in mind and to really always be doing new innovative research to look for new ways to help take care of people. This is just something where now that I've seen what I've seen, I've looked at the data, I've done my own analysis and research on it. I've talked to some of the leading experts in the field at this point. And there's enough evidence for me to go out and protest for people who may not know the data and may not really understand some of that kind of stuff that's going on.
This is a very interesting question. I'm sure you guys are surprised that I'm here. So most of my friends are in the financial industry, and so their prospective fields are suffering. From them, what they say to me most often is, well, you're a physician and your business hasn't been affected. And not only that, but for the first time in my career, instead of my presence being one of relief, it's now one of fear. The first thing a non-COVID patient asks me is, were you in a COVID room earlier today? Every time I make a right or a left, I'm being judged.
Pretty lucky to say that I haven't really been judged based on my position because I think I'm actually in the majority group in advocating for self-isolation. I mean, I've been judged on plenty of other things being on social media. One of the things I recently spoke up for was, to end violence and hate against Asian American people of descent because of this pandemic. And I think ultimately we're all on the same page. We all want what's better for the greater good. And, to you guys, you think that is getting the economy back up again. If we hit it hard, like we are right now with the quarantine, and we continue to stay on track, I think we all ultimately get to go back to a normal life faster. I don't think pro-self-isolation means that we're anti-economy. I'm with you guys. I want the economy to open back, but I only want it to happen.
Yeah, that's true, Magno. I hadn't really thought about how the reaction to the doctors would change, but it makes sense. People are going to be very cautious of their medical professionals because at least most people who don't have their heads up their ass understand that they have to see all patients, including COVID patients. And yeah, that is a risk. Oh, I invite any Republican who would like to take issue to come in and have a chat. They can even do so live if they choose.
Happen when it's safe to do so. And that's just based on, objective data.
I have learned something from the other side.
Can I ask a question? Do you mean in this conversation or like in general?
In this conversation.
Oh, in this conversation. Okay, I'll stay.
Thanks,
I
Allie.
was offended.
I was like, dang, dude.
I'm also an open-minded person, and I understand the frustration from both sides. It is a nuance. It's not a one or...
Yeah, this is a big issue that the social media age has brought, is that, as Peter Coffin and I, to a much lesser extent, have talked about constructed realities, where you construct the news you get, the people you talk to, you know, the construct your news feed on Facebook or Twitter or what have you. You don't necessarily get those dissenting opinions. Now, some people can go out of their way to make sure that they get those dissenting opinions, but most people don't. And so if you don't get those dissenting opinions, it can be very difficult to learn what the other side is actually saying. You just get the propagandized version of what your side says about the other side. So that is one good thing about these kind of videos, these kind of programs where they have two sides come together and talk about it. And I think this particular one, they were both fairly evenly matched. This wasn't like others where they've had, you know, two popular media trained people and a less popular media trained person on one side and three nobodies on the other.
For the other issue, technically, I think that there obviously is compromise that should and can be made.
Dagny, you said something that I thought was pretty profound. Being pro-isolation doesn't mean...
Apparently Streamlabs heard you and agreed with you, Lester X, but thank you.
Anti-economy. You know, I'm guilty of looking at the other side and thinking, you people just don't even care. You've said yourself, you're having, you know, your personal situation has been impacted. And so I really appreciated that point that you made, and then getting a better understanding of where you're coming from.
This is one of the most pleasant conversations I've ever had in terms of being able to discuss politics, science, current events in a way that was...
I would argue it's not necessarily how the systems are designed, it's just how they've kind of coalesced and how people use them. I would argue that Twitter especially is designed for people to have the ability to sort of passively absorb the other side's opinion. You don't have, like, you can just follow someone and they don't have to follow you back or anything like that for you to get a feed of what they post. Now, something like Facebook, where in order to get the feed, they have to, you know, friend you back. They have to agree to the friendship. That I can see the system working against getting people who disagree to see each other's work. But also, you know, block and mute are theirs. Mute is one where if you mute someone, then they can still see what you say, but you don't see what they say. So it's... Honestly, I wish more social media sites had a mute function as opposed to just the block function.
Was productive. And so with that, you learn a lot from everyone who is included. What it shows to me is it shows the model behavior that I feel like our country should have in regards to how to be productive about setting appropriate restrictions, setting appropriate business opportunities for everyone. And I think it can be done. I've learned so much from you guys. I wrote it all down, actually, and I'm going to take it with me, put it here, and use it next week.
I feel like we're friends. I enjoyed it.
Austin, Dags, once they lift these restrictions, we're all getting together.
Let's do it.
I'm in Orange County too, actually.
Alex, Allie, and Jules.
I'm glad they all had fun. This was actually, I think, a more productive... there were a couple of really stupid takes here, but this is something where I don't think there's a right answer, because I agree that without some major changes, I don't think there's a way we can keep the quarantine in place long enough to beat this disease. Because we're looking at literally a year until we can have full vaccination. If we ramp up testing, get some more relief out to regular people, you know, we can make some changes. But the problem is that people aren't calling for the people who are calling to reopen the economy aren't the same ones who are calling to ramp up testing and that kind of thing. Yeah, that's true, Dodge. I forgot that you can, on Facebook, you can stop seeing posts from people. But yeah, this, I think, was a good bit here. It was fun and informative. Hey, thanks for watching. Hope you enjoyed the show. If you liked it, like, share, subscribe, and leave a comment. Thank you. See you next time.